So in these 5 points, if you elaborate accordingly, when composition will be there, age, sex, military, etc. So this must be clear to you. And in demography, I have discussed so many migration, social, households, families, etc. Yes, we have to know a bit about households. What do you mean by family? Often question comes, family definition of so many different types of families. The definitions are there. You will get in the books. What in our country we follow. All this you have to know. Single family or joint family or single parent family, etc. etc. But you have to know, especially for doctors or medical personnel and who will be in service, especially, I mean mainly government service, etc. There you have to know fertility, mortality statistics a bit more. Of course, it is also much important for you for your exams also. Fertility. Fertility means, often we call a woman is fertile or a couple is fertile, means capable of giving birth. Okay. So fertility means birth related. Fertility is you can say a bit of scientific term or like that. Birth layman use. But often we usually say fertility rate or not like that. Often some of the terms are much more common. Suppose we call birth rate. Very common. Anybody may ask you, what is the birth rate of India? It is school questions. You have to answer it. Okay. So fertility, different types of, you can say different types of statistics, or you can say different types of parameters, or you can say different types of indicators by which fertility is measured. Fertility, birth you have to measure by different types of statistics or data, or you can call indicators, or you can call parameters, etc. The first and foremost fertility statistics is birth rate, or often called crude birth rate. Often I am coming one by one. Achha, one thing always remember, I am telling you, don't forget it throughout your life, because you may be in service, you may ask your staff, yes, to do survey, how much birth rate, to do a investigation, what is the birth rate of that area, etc. Always remember, for fertility statistics or for study of the fertility or study of birth, scientific study of birth of the population, always remember, any fertility means live birth. Always remember, live birth. Live birth, do you understand? Suppose a baby is born. After baby born, that baby survived for 1 minute. It will come in the fertility statistics. But a baby is born, often we call a term, have you heard of it? Stillbirth. Stillbirth, have you heard the term still? Stillbirth, still means what? Notchena, chotchena, still. Stillbirth means dead baby. Often the scientific term called stillbirth. So if stillbirth is there, that is dead baby born, or baby already died in the mother's womb and delivered, it will not come in the fertility statistics. Don't forget. But if the baby dies after 1 minute, it will come in the fertility statistics. Okay. Then after death, it will come in the infant mortality, or I will come in mortality indicator. Always remember. So often, when we suppose somebody is asking you, how do you define crude birth rate? So all these definitions, every definition I will call you, you can give in sentence wise, or you can give it in formula wise. Suppose birth rate, any, we will come after all are same. So suppose birth rate means birth rate of Bolpur, birth rate of West Bengal, birth rate of India, birth rate of other states. Birth rate means number of total births. That means live births. Often we cause births. Some of the terms we don't use it, but scientifically wrong. So if anybody he says that, sir, total number of births, live births, examiner will impressed. But somebody is saying total number of births, that means you are meaning live births. Always remember. So for all types of fertility data, fertility study or birth study, always we remember that we have to calculate, we have to measure only live birth. Live means LIVE, জীবন্ত বাচ্চা, জীবন্ত, জন্মাবার 1 মিনিট বা 2 মিনিট পরে মারা গেছে, কিন্তু it will come in the fertility statistics. So it is a number of births, always number of births, number of total births, or you can say birth or live birth divided by estimated mid-year population into 1000. This is the difference. The other day I told you how will you, what is the tools of demography, that is some constant is required. It is measured in 1000. It is rate because it is number of live births our total population. It is two subgroups of population or two events. Okay, so no, sorry, not two. It is the same event, same number of frequency out of total population. Usually it is called mid-year population. It is said that in the mid of the year, the population remain constant. So estimated mid-year population is taken. But any time, any type of population. Suppose today we are studying in this area, number of births. So today it will take maybe 7 days to Bolpur area and etc. etc. So I will see how many births in every house and all those things divided by total number of population. Okay, so if you define it, suppose why I am telling you several times this, if you remember in this way, you will never forget. All definitions you can write or say, one cannot say like that, you can write in that way, but you can write in that way. Suppose you can give in a sentence wise, sir, birth rate is defined as total number of live births per 1000 mid-year population in a defined geographic area in a defined period. Then the definition will be complete. This type of definition, it is applicable for all, for birth rate, death rate, all types of birth rate. So birth rate is defined. It is not very difficult to memorize, or if you understand it. So birth rate is defined, or birth rate is total number of live births per 1000 mid-year population in a defined geographic area in a defined period of time. Defined geographic area, I have told you, maybe for this district, for this area, or for India, okay? And in a defined period means this year, last year, or subsequent years when we will do. So that, then the definition is complete. So in all types of demographic parameters definition, you must complete it in a defined geographic area, in a defined period. So if anybody asks you, how will you define the birth rate of Birbhum district? So you have to say, sir, it is the total number of births in Birbhum, Birbhum you can say last, it is the total number of live births per 1000 mid-year population in the district Birbhum for the year 2024 or 2023, last year. Okay, so this must be complete, so you will never forget. Then you will get the full marks. If you say defined area or defined period of time. Okay, or you can write in that fashion in a defined period, in a defined population or defined area. Okay, so but total number of births. But there is often called birth rate and crude birth rate same. Birth rate or crude birth rate same. Why it is called crude? Or you can say birth rate same. That means it is a crude birth rate. Crude কথার মানেটা কি? What is crude? Crude এর মানে জানো তো? Crude. It is not refined. It is not actual. It has got a fallacy. Why crude? Common sense, এটা দেখলে মনে থাকবে. It is the total number of births divided by mid-year population. Population means children, boys, girls, married, unmarried, old, widow, all are there. Are all exposed to birth. Are all exposed to birth. আর বলো না কিছু. মাত্রা তো নাড়ো না. Nobody is exposed to a বাচ্চা কিন্তু বার্থ হচ্ছে না, জন্ম হচ্ছে না, একটা ছোট মেয়েরও জন্ম হচ্ছে না, একটা মেলও বার্থ প্রডিউস করছে না। So it is a crude definition. So it is called crude. It is about to get an idea. But why it is crude? You cannot compare it with other areas. You cannot compare with other countries. Suppose in our country, so you have to understand, in our country young population is much more. Children population much more, people birth rate is more. But if you go in Western countries, East European countries, or some West American countries, their birth rate is less, so number of children are less. Their old age population is much more. Here old age population is not that much. Their age of marriage may be at later age. Here age of marriage is early age. Okay. So you cannot compare these areas or our country's birth rate to other countries. So it is crude. Is it clear or not? So the often examiner asks you why it is called crude birth rate. Sir, as this it is a total number of births out of the total population, and total population consists of male, female, children, adolescents, married, unmarried, all are not exposed to birth. Who are giving to birth? The married women are giving birth, or who are in husband and wife, who are having in sexual relationship, right? They are giving to birth. So it is a crude. So if it is a crude, what to second man for a defined, but this statistics, this parameter is used very commonly. Often it is asked, do you know what is the present birth rate of or crude birth rate of India? I mean, again, these are school level questions. I don't know why all of you don't know. You have to go near to it. May not be 100% correct, nearer to it. I may not be 100%. Our present birth rate may be, I don't know, around 16 to 17 per 16, suppose, or latest. Always you will get in the net or like that, or books or like that. It less than 20, probably 16 to 17. That is 16 to 17 means out of 1000 population, 15 babies are born in a year, or 16 babies are born in a year in India. Out of 1000 population, 15, but if you saw the birth rate of maybe suppose Sweden, birth rate of Germany, maybe 5 or 6, that is 6 babies are born out of the 1000 population. So this 1000 is given constant throughout the world. And what is the present death rate? Will come. Death rate is around now around 7 per 1000 population. So birth is around 15 or so, and death rate is around 7 or 8, like that. So this is crude birth rate. So if you want to bit refine it, second type of parameter is general fertility rate, a bit refined. Here the এটাকে কি বলে? Numerator. This is denominator. Here numerator always remaining the same. Denominator is women of the reproductive age group. Who are the women of reproductive age group? কাদের বলে women of reproductive age group? তোমরা সেকেন্ড ইয়ার, তোমরা যদি এগুলো না জানো তোমরা পরীক্ষা পাস করবে কি করে? Who are the women of reproductive age group? কোশ্চেনের মধ্যেই তো অ্যানসার আছে. Women of reproductive age group. That means women who can give birth. কারা আমাদের দেশে উইমেন অফ রিপ্রোডাক্টিভ এজ গ্রুপ? হ্যাঁ, 18 না হলে আমরা ইউজুয়ালি এখনো 15 বলি, কারণ আমাদের দেশে ম্যারেজ ইজ ভেরি আর্লি। ওকে, গ্রামে গঞ্জে ম্যারেজ আর্লি হচ্ছে। 15 to 45 ইয়ার্স এজ গ্রুপ আর কল উইমেন অফ দ্য রিপ্রোডাক্টিভ এজ গ্রুপ। 45 এর পরে ইউজুয়ালি 45, 49, কেউ আজকাল 49 বলে, কারণ মেনোপজ ইজ ডিলেইং। মেনোপজ, ইউ আন্ডারস্ট্যান্ড, মেনোপজ ইজ ডিলেইং। So and menstruation started, or menarche started early, started menstruation. So ovulation and all this are there. So chance is there. Teenage pregnancy and all those things are there. You come in the newspapers, etc. So it is the general fertility rate is defined the number of total births out of the all women of reproductive age group 15 to 45. So all women of reproductive age group are not married. They are not exposed to birth risk. So general marital fertility rate. I told you, if you understand one, others are very easy. General fertility rate is same number of total births or live births out of the married women of reproductive age group. Married women of reproductive age group. That means 15 to 40, out of 15 to 45 year age group who are married. So that will come in the denominator. And into 1000 in a defined geography area and a defined period of time. Okay. So that also 100% not refined, because here general marital fertility rate, age of marriage differs. You cannot compare it with other countries, or separations are going on in any society, or divorce is very much going on in other society. So it cannot be compared. But and especially in our countries as early marriage is common, but in other countries marriage is very age of first marriage may be a bit less, delayed, maybe 25, 26, 30, 35 etc. like that. So you cannot compare it properly. So coming to it, another specific is, and I have already told you, our age classification differs from country to country. Our young age is less, their young age, our young age is more, their young age population is much more less. So their old age is much more, our old age population is much less. Our people in the reproductive age group are much more. Okay. So and it differs also between the family planning, also all like that, how much contraceptive or family planning program is going on. So many things are there. So it is better if you compare it as a specific fertility rate. A specific fertility rate means at particular age what is the fertility or what is the birth rate. A specific fertility or a specific birth rate, same name. So it is the number of live births, suppose at age 20, number of live births. When you do the survey or when you do the investigate, you will take all 20 age group people, I mean women who are giving birth at the age of 20. Or you can make it at a class interval type, 20 to 25 or like that, 20 to 25 years. You will count that births going on in 20 to 25 years age group. Births going on, divided by total population of 20 to 25 years age group. That is age specific, age. Births at particular age or age groups, birth at particular age or age groups divided by total population of that particular age or age group. Is it clear? Very simple. So you can, that is comparable to other countries, area to area. You can compare our 15 to 20 years age group or 15 years age group with the 15 years or to 15 to 25 years, 20 years age group of other areas, other countries. You can compare 25 to 30 years age group birth to other areas, a bit comparable. You can compare. Then you can say, yes, our fertility is better or their fertility is better or we are controlling it, all these things, age-specific fertility. So it is a bit more refined. But you will not get the total idea what is the fertility picture of a country or on these things, for which comes total fertility rate. This is very important. Often question come with total fertility rate, because total fertility rate, some parameter is given to achieve it. It is said that already when we were students, it was said that we have to achieve total fertility rate 2.1. I am coming 2.1. If we can achieve 2.1 in our country, the population will be stabilized. Already we have achieved it. Now the total fertility is 1.7 or 1.8. That means for this reason I wrote it. You can understand it, it is easy, or you can remember it. It often comes in the exam, it often asked. That is, it is nothing. Average number of children that would be born, jeta jonmabe, to a woman by the time she ended his childbearing years. Ended his childbearing years means up to 45 or 49 years age group. If she has to pass through her childbearing years means reproductive age years, 15 to 20, 45, conforming, I mean at the level of age specific fertility rate of a given year. Understand it, you see? If you don't understand, it is easy. Average number of children, that means you know already it is documented. You know the age specific fertility rate of area. Statisticians are doing it. The Ministry of Statistics is there. Department of Statistics is there. And central government very strong, in state government also there. So they have age specific fertility rate. So today you are applying, suppose you are applying, that is statistically it can be applied. They do it better, we may not. You are applying, suppose 15 years age specific rate to the population, 16 years age specific rate, 17 years, 18 years, 19 years, 20 years, up to 45 years, you apply it. Today's age specific fertility rate, and you can calculate it at the end of this population, at the end of 45 years age group, the women of this country or a particular woman can give how many children. Though it is called that pregnancy is 9 years, 9 months, some days extra or like that, or 10 months in average. So it is possible, but that every year 15 to 45 means 30 years age group. Around the 30 years every day birth is possible, every year birth is possible. That means a couple may have 30 children or 15, 20 children, but that is not possible. That don't happen. There are several factors are there. Lactation, amenorrhea and all those things is there. Family planning is there. People are not wanting children. So many factors are there that we are not discussing. So total fertility, always remember, average number of children that would be born to a woman. Applying a specific fertility rate of the current year, how many children it would be at the end of childbearing years, at the end of 45 years. Okay, that is it. So when Government of India has given the target that we have to achieve 2.1 total fertility rate, that means, what does it mean? 2.1 children per family. One family may have 12 children. Suppose I don't know Lalu Prasad Yadav and all these things, probably 9 or 10 children are there. But one family may not have any children. So it is the average number. So average number of the population, average number in India. So it is said that if 2.1 children, that is average number, will come per family in India, then the population will be stabilized. It has already achieved. For the last 3 or 4 years or 5 years, it is now day by day is decreasing because birth rate is diminishing. So it is 1.8, 1.7 or like that. Okay, so you understand total fertility rate? It is even, I cannot remember it, but I will mean it. It is the average number of children that would be born, jeta janmabe, applying the present age specific fertility rate to the particular woman or women of the country at the end of his childbearing age. At the end of a childbearing age means 45 years, applying age specific fertility rate. But this definition is also 100% not refined. Why? Just see common sense. Why? It has been given average number of children. Children means both boys and girls. Boys are giving birth. No. I mean girls are giving birth. So second definition is called, it also comes in the exam, gross reproduction rate. The same definition, only average number of daughters. So if you know the definition of total fertility rate, you will know the definition of gross reproduction rate. They are average number of children that would be born applying a specific fertility rate. Here average number of daughters that would be born applying a specific fertility rate of the present year. Right? But this is also not 100% refined. Again you have to in the because today you are applying a specific fertility rate. That means considering a particular woman X, you are applying, suppose this X is now 15 years of age. So you are applying 15 years age specific fertility rate, 16 years, 17 years, 18 years, 45 years. Then you see how many children or how many daughters will be born. Okay? This 15-year lady may die at the end of 20 years. But you have only applied it and calculated it. Okay? আজকের যে মহিলা 15 বছর বয়স সে তো 30 বছর বয়সে মারা যেতে পারে কি না পারবে না মারা যেতে পারে সুতরাং but you have already applied it and get the results. So gross reproduction rate, it is often gross reproduction is called the reproductive engine of population because we are considering only women, children, age specific fertility. So net reproduction is you have to consider not only age specific fertility rate, you are applying age specific mortality rate of the women. That is same definition. Average number of daughters that would be born to a woman by the time she ended childbearing years, if she has to pass through her childbearing years conforming to the age specific fertility and age specific mortality rate. That women's age specific mortality rate we will discuss. Okay, this is called net. তোমরা যখন চাকরি করবে, আমরা এখন চাকরি করি, আমাদের একটা স্যালারি হয়, স্যালারি দ্যাট ইজ কল্ড গ্রস স্যালারি। After deduction of income tax, so many tax, professional tax, etc., we get what we take at home. That is called net salary. That is a net reproduction rate. So if you know the total fertility rate, number of children applying a specific fertility rate, then as to make, you have to apply average number of daughters that would be born applying a specific fertility rate or a specific birth rate. Net reproduction rate is average number of daughters that would be born applying a specific fertility rate of the woman and a specific mortality rate of the woman. তাহলে চান্সটা will be. It is said that in NRR, these are often short name you have to remember because often it comes. TFR, total fertility rate, GRR, gross reproduction rate, and NRR, net reproduction rate. It is said that NRR should be 1. NRR should be 1. What does it mean? In this world, in this area, in this country, one woman will be replaced by another woman. NRR should be 1. Very interesting. And then population will remain stable. So it is average. So that means আমরা যখন দেখব আমাদের average number throughout this families in India, one woman will be replaced by another woman. তার মানে একটা করে ডটার জন্মাবে, that doesn't mean every ফ্যামিলিতে জন্মাবে, it will come average. কোন ফ্যামিলিতে একটা ডটার আছে কি, চারটে ডটার আছে, কোন আর পাঁচটা ফ্যামিলিতে হয়তো কোনো ডটার নেই, but average will comes 1. Is it clear? So it is said that when we will achieve 2.1 birth total fertility rate, slowly and slowly we will achieve net reproduction rate 1, then the population will be 100% stabilized. So demographers are saying that in 2040 or 45 or maximum, even maybe early or a bit late, within 2050 it must, the population of India will be 100% stabilized. It will not increase, it will not decline. Then of course, then after that decline will start. What is started in most of the Western countries, decline starts. Asian countries, Japan also, and so many East European countries, population is declining. That is, death rate is more than birth rate. But our not declining because our birth rate is more than death rate. Okay, so our population is increasing slowly, slowly. So as it is achieving 2.1 and slowly, slowly birth rate will be declining. So one day the population will be stabilized. Right? So fertility statistics, if a question comes, how do you study fertility or what are the different fertility statistics? You have to give from the very beginning birth rate or crude birth rate, same. Birth rate or crude birth rate, same. Birth rate, general fertility rate, general marital fertility rate, age specific fertility rate, total fertility rate TRR, TFR, gross reproduction rate GRR, and net reproduction rate. You have to explain it. And there are other not that common fertility statistics are there. It is called replacement level of fertility, same thing. That is level of fertility at which women of the same cohort, exactly the same daughters. Cohort I have already told you, that is the same demographic characteristics. Suppose the population of Birbhum, a bit of cohort, if population remaining same, you are applying in other cohort, other district or like that. So in this cohort means in this area the population remaining, average number of women of the same cohort will have exactly enough daughters to replace them in the population. That is when you achieve NRR 1 or 2, you will replace the level of fertility. These are explained, but if you write it or if you don't remember it, they will not. But you have to, up to net reproduction rate, you have to give your answer. If somebody answers much more, then he will get a bit more marks. it is child women ratio nowadays not that much followed. Suppose nobody has studied in Andaman area and all those things. So if you want to get a study to you have to out of the women what is the child in an area where people cannot enter, demographers cannot enter, health professionals cannot enter. So to get an idea, some of the Asian countries or tribal areas or African countries it may be required to get an idea what is the child women ratio. Birth rate of unmarried women, that is a bit of statistics. Birth rate unmarried women who are becoming pregnant but not married, that also a bit of statistics. You have to study it in because society is changing, as you know, all these things are there. People are living together and may give birth to birth. Okay, so birth rate. So it is the fertility. So if anybody a question comes, how do you define or how do you study fertility of a population? So you can study it in these parameters: birth rate, general fertility rate, general marital fertility rate, age specific fertility rate, total fertility rate, gross reproduction rate, net reproduction rate, then birth rate of unmarried women, child women ratio, representative fertility, etc., like that. Okay, this is about very important for you because fertility studies often asked, and again I am telling you, often it is asked, if you cannot answer more, what is the present birth rate of India, or what is the at least where as we belong to West Bengal, you are coming, maybe you are from other states, but you are studying in West Bengal, so at least you say you should know the birth rate of West Bengal before coming to the exams. Or if you belong to Bihar or if you belong to Haryana or like that, at least you have to know your areas and all those things. That does not happen. But total birth rate of India is very important. Adds total population of India or etc. or total population of the state. That you have to know. All statistics we cannot remember, but some which is very important for us, we have don't forget it. It does not mean you have to say exactly, but nearer to it. Factors affecting fertility that will be discussed in much more class, you know, cultural factors, social factors, economic factors, so many things are there in our country, health factors, you can elaborate is more, that will be discussed in when we discuss RCH program, etc., etc. Operate mainly through the specific biological factors or parameters, health factors like proportion of human and sexual union. The other day I told you that Japanese population is not increasing because most of them may not be in the sexual union. If sexual union is much more, birth rate will be much more, so it will factor, it is also a factor. Proportion of eligible couples, our eligible couple population is much more. There is a definition of eligible couple, often it is asked, what do you mean by eligible couple? Eligible you understand, to get a service, if you are eligible, suppose you have to pass MBBS or if you have to pass MD or like that, for that particular post your eligibility. So what do you mean by eligible couple? Couple means, couple kake bole? Who are couple? Right? Husband, wife, they are couple. So what do you mean by eligible couple? Huh? Reproduction. But eligible kotha ta ekhane ekta importance ache. They are eligible for contraception. So amra kader contraception di ba family planning kori? Who are married? Okay? Who are married, the couple? So eligible couple ekta definition. Eligible couples are those couples, that is husbands or wife, where the age of wife is 15 to 45 years age group. We cannot consider the age of husband. Dorkar? Husband age consider korar dorkar ki? Keno? Examples are there. Ravi Shankar je last child, je ki naam Tanushree na ki naam Shankar? যে বিখ্যাত গ্র্যামি অ্যাওয়ার্ড পেয়েছে, ও তো হচ্ছে রবিশঙ্কর যখন বিয়ে করেছিলেন হি ওয়াজ 68 or 69 লাস্ট বিয়েটা, আর ওয়াইফ ছিল আমি জানি না ওর নাম কি 39 না 38, তার বাচ্চা হয়েছে, সে তো এখন বিশাল আই মিন তনুশ্রী না কি যেন নাম, অনুশ্রী না কি যেন, অনুশ্রী শঙ্কর লাইক দ্যাট, গ্র্যামি অ্যাওয়ার্ড পেয়েছে। সো হাজব্যান্ডস এজ ইজ নট কনসিডারেবল, বাট উইমেন এজ ইজ কনসিডারেবল। সো ইফ এনিবডি আস্ক ইউ or anybody ask you, how do you define eligible couple? Sir, eligible couples are those couples or husbands and wife, couple mean husband and wife, where the age of the women or wife, age of the wife is 15 to 45 years age group. So why it is called eligible? Because for our national point of view, from our program point of view, we can apply family planning advice, we can apply family planning devices to them. They are eligible for contraception. সে কন্ট্রাসেপশন আমি নেবো কিনা, দ্যাট ইজ ডেমোক্রেটিক রাইট, বাট ইট ইজ আওয়ার ডিউটি টু মোটিভেট হিম। দেখো তোমারই একটা বাচ্চা হয়েছে, এখন এনজয় করো লাইফ, এখন বাচ্চা কাছাকাছি যাতে না আসে, সো ইউ টেক দিস ওয়ান, you can use condom, you can give tubectomy or if you don't any child, or you can use other IUCDs যেটা ডিসকাস করা হবে, পড়ানো হবে, অবস্টেটিক্স গানিত পড়ানো হয়, আমাদের মেইনলি পড়ানো হয় intrauterine contraceptive devices etc. or oral pills etc. etc. So they are eligible for those purpose. So these called eligible card. Proportion of breastfeeding women. If breastfeeding is much more, proportion of breastfeeding women much more, the birth will be less, because it is seen that scientifically when women are breastfeeding, our breast milk secretion is much more, then lactational amenorrhea takes place. Lactation means the period where breastfeeding is going on, that period is called lactational period. So amenorrhea means absence of menstruation. So during lactation or breastfeeding it becomes, যত breastfeeding হবে তত already nature I mean amenorrhea usually হয় most of the cases. So breastfeeding women, if more, fertility will be less. So these are the factors. It will be discussed in detail more. But just to know. Proportion of women unit contraceptive, সেটাও হতে পারে। কন্ট্রাসেপটিভ প্রিভ্যালেন্স রেট যদি মাছ হয়, আমাদের পপুলেশন এখন বাড়ছে, ইট ইজ সেড দ্যাট আওয়ার কন্ট্রাসেপটিভ প্রিভ্যালেন্স রেট ইজ অ্যারাউন্ড 60% or like that, or 60-65%. That is, out of 100 couples, 65 or 65 using some types of contraception, others not using it. Level of induced abortion. You know, abortion is now legally permitted. That is called MTP Act, by medical termination of pregnancy. Very important. You have to know the latest acts, latest amendments. That পড়ানো হবে বা তোমরা পড়ে নেবে, এটা it will come in the exams. So number of abortion per women of the reported abortion rate, abortion ratio, এগুলো একটা terms আছে. So abortion is nowadays legalized up to some period, 20 weeks of pregnancy or 24 weeks of pregnancy, actually the conditions are there. You have to know it. If you have MTP Act, you have to note when it started, a bit history, and you have to know a bit MTP Act etc. সেটা লেটেস্ট সব বইতেই পাবে বা নেটেও গিয়ে পাবে, বেসিকটা ইউ হ্যাভ টু জানতে হবে। কতদিন পর্যন্ত আমরা লিগালি অ্যাবর্শন করতে পারি, কাদের অ্যাবর্শন করতে পারি, বা ইভেন আনম্যারিড গার্লসেরও আমাদের দেশে অ্যাবর্শনের একটা আছে, ইফ ইট ইজ কজড বাই রেপ অ্যান্ড আদার থিংস, অর আই ডোন্ট ওয়ান্ট টু অল দিস থিংস, ইফ that unmarried girl comes with a guardian, all this, that is also provision is there. India has made a havoc on all these things, but some of the countries it is not there. You know, this American there is a fight that democratic, one of the reason why Trump won this Republican Party, because they are vocal for abortion. But some of the Democrats are that they are not vocal for abortion. So many churches in the all the Pope and all those things, they are not they don't want to that do abortion. They call it is a crime in those countries. But in our country it is legalized up to some period of pregnancy. Okay. Morbidity we will not discuss much more, because that will be discussed much more in epidemiology. You know, in morbidity means, morbidity কাকে বলে? Morbidity is a scientific term. Illness, sickness, that is morbidity. Today I am morbid, that is I am a bit ill or sick. So morbidity rate is divided, suppose incidence rate is defined as number of new cases in a particular area. Suppose today I want to see, or this week I want to see how many people have started, or I mean transmitted, or I mean sorry contaminated by malaria. So that is incidence, new cases. Prevalence means both old cases and new cases. Today I am doing some survey, or this week I am doing survey, maybe someone, suppose TB cases of the TB, for the already people are suffering from TB, those are in my data, and new cases developed during my service. কাল বা পরশু থেকে স্টার্ট হয়েছে, বা আমার আজকের পিরিয়ড থেকে চালু হয়েছে, both new and some cases, that will be discussed in it. That is called prevalent rate. Case rate in particular disease কাদের case rate বলা হয়. Okay, case fatality rate means we often called that this cancer is very much fatal, or COVID is very much fatal. That is, out of those persons who are suffering from particular disease, how many are dying? The case is fatal, মারাত্মক, মানে প্রচুর লোক মারা যেতে পারে, okay, fatality rate. So that discussed in the morbidity rates, etc. But we will discuss mortality. Just like fertility, we will discuss mortality rate a bit more. Mortality means morbidity, sickness, mortality, death. Mortality is death. So mortality is death. So just like birth rate or fertility rate, it is also same types of death rate or crude death rate. Same thing. So number of total deaths out of the median population in 1000. So death rate or crude death rate is defined as number of total deaths out of 1000 median population in a defined geographic area in a defined period of time. Just like birth rate, same definition, only death will be there. Okay? So often it is called crude because, again I am telling you, chances of death kader beshi. What chances of death? At extremes of age. That is, who are very children or extremes of age and who are very old, তাদের chance of death, anybody can die, but chances of death are much more. So this age classification population also varies from area to area, right? Or disease burden differs from area to area. In our country, disease burden, maybe communicable disease burden is much more. The other day probably I told you that Aditya Birla died at the age of 55 in London because nobody could diagnose it. He died of malaria, very sad. ওদের দেশে ম্যালেরিয়া হয় না, মস্কিটো কামড়ায় না তখন, এখনো তো কিছু মস্কিটো আছে। So the doctors were not acquainted with the signs and symptoms of malaria. কিন্তু আমাদের দেশে we are very much acquainted with the signs and symptoms of malaria because malaria very common in our society. Okay, so disease burden also differs. So crude death rate, it is also called crude, just like birth rate, crude death rate, it is also called crude. It is not age specific. So you can get age specific death rate will be much more comparable. So number of deaths at particular age or particular age group out of 1000 median population of that particular age or particular age group in that particular period, in that particular area. Same birth rate, death rate, if you understand, same definition. So age specific death rate, number of deaths per in a particular age or age group out of the 1000 median population of that particular age group. That is, suppose 5 থেকে 10 বছরের মধ্যে কতটা মারা যাচ্ছে, আমি 5 থেকে 10 বছরই কাউন্ট করব, টোটাল পপুলেশন ডিভাইড করব, ডিনোমিনেটর 5 থেকে 10, বা 10 থেকে 20 এর মধ্যে কত মারা যাচ্ছে, বা 20 বছরে কয়েকজন মারা যাচ্ছে, তো আমি 20, and that will I can apply it other areas. তাহলে আমাদের এরিয়া বেটার না কেরালারটা বেটার না হরিয়ানারটা বেটার না গুজরাটের বেটার? So age specific death rate very important, age specific fertility rate they have to calculate it very. Cause specific death rate, in which cause death is there, death due to particular cause, due to TB or other things. Proportional mortality rate, that is proportion dying at a specific case, how many proportion is dying in a particular disease or like that. Very important, this you have to remember. Now comes just total fertility rate. Infant mortality rate, who are infants? Infant kader bole? Less than 1 year, up to 1 year of age. Who are called, these terms are very important, I am telling you. Who are called neonate? 0 to 28 days, very good, 0 to 28 days. Often we call it 1 month colloquially, but it is 0 to 28 days. And after 28 days to 1 year called post neonates. And who are called perinate? P-R-I-N-I-T. This is also important, perinate. P-R-I-N-A-T, perinate. Peri means what? Peri, around. So suppose this is the delivery point, delivery or birth. Before that, pregnancy was there. 28 weeks of fetal stage up to the 7 days of life. These babies are called perinates. That is, fetus in the womb, or fetuses coming out after 28 days, 28 weeks of gestation, 28 weeks of pregnancy, 28 weeks gestation to up to 7 days, after birth. এদেরকে বলে peri means around peri. These are called perinates, very very important. So you have to know what is by neonate. First 28 days called perinate. Often this is the term early neonates. Early neonates are called up to 7 days. Because why these terms are there? So many programs are now going on. Their chances of death and all those things are much more. এগুলো আমাদের so many programs coming, death rate গুলো অনেক কমছে এখন, খুব ভালো অ্যাকশন হচ্ছে। Perinatal mortality, that 28 weeks of gestation, all these things. In obstetrical terms, before 28 weeks, if any fetal death is called, it is usually called abortion. নষ্ট হয়ে যায়, abortion. But after 28 weeks of life, it is called chances of survival of the baby is much more. So 28 weeks of যারা জন্মাচ্ছে তাদের chance of survival becomes much more. Okay, it can be. তার আগেও করা যায়, but it is in average. So 28 weeks of gestational age babies to after 7 days of life called perinates. So you have to know what is infant, what is neonate, what is post neonate, what is perinate. এই টার্মগুলো very important because so infant mortality rate is defined as number of infant deaths, that is within first year of life, out of the total live births. Out of the total live births. Live births you are getting, it is very easy to get. Everything is nowadays registered. So how many babies born within 1 year of age and then divided by total number of live births into 1000 in a different geographic area, different period of time. Infant mortality reduced very very good action going on by different national programs. It is now less than 30. Our target was 30. When we were students, it was 150 infant deaths per 1000 live births. When we were students, now it is becoming throughout India. It is becoming less than 30 totally. Some of the states it is much less. Perinatal mortality rate, again number of perinatal deaths, that is death of the late fetal deaths, death of the fetuses after 28 days of gestation and babies up to 7 days of life. Out of the total live births, right? All these definitions you have to know, it will come and it will be examined. Neonatal mortality rate, again same thing, number of neonatal deaths, that is death of the babies within 28 days of life, out of the total live births. That means 1000 live births in a defined geographic area in a defined period of time. Again, I have told you that as child period or infancy period is very important, and we have done a lot. In other countries it is much more developed. Our country is also slowly we are achieving it. So it has given another type of 0 to 7 days mortality rate. Again, deaths during up to 7 days of life divided by total number of live births. Denominator is always total number of live births. Post neonatal mortality rate, again same, under 5 mortality rate. Maternal mortality ratio, this is very important. Maternal mortality ratio. Before maternal mortality ratio is often called, I am telling you, maternal mortality rate, but it is not rate. Why it is called ratio, I am telling you, coming to you. Before that, you have to know what do you mean by maternal death. Maternal death is a definition, very important. It is, always remember, if you understand it, you can memorize throughout your life. It is the death of the woman during pregnancy, during delivery, and within 42 days after delivery. Delivery পরে 42 days কে কি বলে, একটা টার্ম আছে, পিউরপেরিয়াম। পিউরপেরিয়াম, PUERPERIUM, পিউরপেরিয়াম। That is 42 days means 6 weeks. 6 weeks. So death of the woman during pregnancy, during delivery, and during puerperium or up to 42 days after termination of pregnancy, due to any causes related or aggravated during pregnancy, during delivery and during puerperial period or its management, মানে আমরা ম্যানেজ করছি তো, treatment or management, but not due to incidental cause or accidental cause. What does it mean? একটা উইমেন প্রেগনেন্ট, প্রচুর বাড়িতে হয়, বিশেষ করে তার হাজব্যান্ড এসে প্রচুর ড্রিঙ্ক করে এসে মারপিট করলো, হয়তো একটা লাথি মারলো, বেবি ডেথ হয়ে গেল, দ্যাট ইজ নট ইনফ্যান্ট মর্টালিটি, দ্যাট ইজ নট ম্যাটারনাল মর্টালিটি রেট. Or a pregnant baby coming to hospital or going to the roads, hit by a car and died, that is not maternal mortality rate. So maternal mortality rate or maternal mortality ratio, maternal death is, it is the number of death of women during pregnancy. Don't forget, কোনো কোনো বইতে ডেলিভারি কথাটা লেখা নেই, কিন্তু ডেলিভারি ইজ এ পিরিয়ড, বিকজ প্রথম তো few hours, during pregnancy, during delivery and during within 42 days after the termination of pregnancy, irrespective of the size of the fetus etc. or like that or baby, due to any causes related or aggravated or due to management problems, our management problems, okay, and not due to, এই কথা লিখতে হবে বা বলতে হবে, not due to incidental or accidental cause, that is called maternal deaths. So maternal mortality ratio is defined number of maternal deaths. তোমাকে যখন ডেফিনিশন দিতে হবে, তোমাকে maternal death টা ডিফাইন করতে হবে, তাহলে maternal death লিখতে হবে, number of maternal death out of the 1000 live births. For this reason it is called ratio, because I have already told you ratio is defined as the relationship between two demographic events. Numerator টা হচ্ছে number of maternal death, death is a separate event, and denominator হচ্ছে number of live births, births and deaths are separate, so it is called maternal mortality ratio. But often in day to day practice, আমরা আমাদের practice life এ usually maternal mortality rate বলি. Maternal mortality rate means we are giving it maternal mortality ratio. So in exams you have to say maternal mortality ratio, that is another important, because this statistics or this data is very easy to calculate. You can get data from maternal death and you have data of live births. But there is, if you read maternal mortality rate, also a definition, maternal mortality rate. Always remember, when we call maternal mortality rate, আমরা কিন্তু এটাকেই মিন করছি, কিন্তু maternal mortality rate এর একটা ডেফিনেশন আছে, সেটা আমরা ইউজ করি না for our day to day practice because a bit difficult to achieve it. It is the number of maternal deaths out of the women of reproductive age group. উইমেন অফ দ্য রিপ্রোডাক্টিভ এজ গ্রুপের তো আমাদের স্ট্যাটিস্টিক্স নাও থাকতে পারে, তাহলে তো আমাদের সারা দেশে, সারা এরিয়াতে, সারা ডিস্ট্রিক্টে উইমেন অফ দ্য রিপ্রোডাক্টিভ এজ গ্রুপ গুনতে হয় ঘরে ঘরে গিয়ে, দ্যাট ইজ নট পসিবল. বাট দিস ডাটা ইজ ভেরি ইজি টু গেট. ইউ ক্যান গেট ম্যাটারনাল ডেথ রেজিস্ট্রেশন থেকে, তুমি এখানে বসে ফোন করলে দিলে সব সাব সেন্টারে, সব হেলথ সেন্টারে, সব বিডিও অফিস অর ডিস্ট্রিক্ট অফিস এসেট্রা এসেট্রা এসেট্রা, যেখানে বার্থ রেজিস্ট্রেশন ও ডেথ রেজিস্ট্রেশন হয়, এই আমাকে ম্যাটারনাল রেশিও পাঠাও, না নাম্বার অফ ম্যাটারনাল পাঠালো আর নাম্বার অফ লাইভ বার্থস পাঠালো, ইউ ক্যালকুলেট ইট অ্যান্ড গিভ ইট টু ইউর সিনিয়র্স অর মন্ত্রী, তাদেরকে দিয়ে দিল. তো ইট ইজ ইজি. তো থ্রু আউট দ্য ওয়ার্ল্ড দিস স্ট্যাটিস্টিক্স ইজ ইউজড. Though often I am telling you, আমরা এটাকে রেট বলে থাকি, but it is not rate. Scientifically it is ratio. It is a difference between maternal death and live birth, two separate events. Okay? Life expectancy এটা ক্যালকুলেশন আছে, একটা লাইফ এক্সপেক্টেন্সি করা হয় যে কত করে আমাদের লাইফ এক্সপেক্টেন্সি বাড়ছে, লাইফ টেবিলও হয়, লাইফ টেবিল একটা ওই লিখবে, কিন্তু লাইফ এক্সপেক্টেন্সি হচ্ছে লাইফ এক্সপেক্টেন্সি অ্যাট বার্থ হতে পারে, লাইফ এক্সপেক্টেন্সি অ্যাট 1 year of age হতে পারে, হাউ মেনি ইয়ার্স you are supposed to live. The other day I told you আমাদের লাইফ এক্সপেক্টেন্সি এখন বেড়ে গেছে, আমাদের অ্যাভারেজ লাইফ এক্সপেক্টেন্সি এখন 72 to 73 ইয়ার্স, ফিমেলের বেশি, এটা অ্যাভারেজ মেল ফিমেল মিলে, আর মেলদের একটু কম, ফিমেলের মেবি 75-76, মেলদের অ্যারাউন্ড 70. Our average lifespan is 73 or etc. like that. It is increasing day by day. Okay, so these are the fertility indicators or fertility statistics. Morbidity statistics a bit more defined in during epidemiology classes etc. and mortality statistics. So we have to know fertility, some fertility statistics a bit more, are mortality statistics, out of which you have to know what is the death rate of India. I have already told you 7 or 8 বোধহয় হবে এখন, আর you have to know the infant mortality rate জানতে হবে, you have to know the maternal mortality rate. Now it is 1 less than 1 per 1000 live births. So in most of the countries maternal mortality rate অনেক সময় ডিফাইন করা হয় পার লাখ, কারণ অন্যান্য দেশে তো এটা ভগ্নাংশ হয়ে গেছে, ডেসিমাল হয়ে গেছে। ওকে, ইজ ইট ক্লিয়ার?